Good morning friends, I am Dr. Harshavardhan Ghorpade from the Department of Visual Sciences, Fortis Hospital, Vashi, and from Saroj Specialty Eye Clinic, Vashi. I am a cataract, cornea and refractive surgeon. Today I am going to speak to you about a very common occurrence in everyday life, that is eye trauma or eye injuries. There are three types of eye injuries. One, it could be a small foreign body or a large foreign body. Second, it could be a chemical injury. And third, it could be a mechanical injury. Now, talking about foreign bodies, they can happen anywhere, while playing, while working, especially or while traveling, especially while doing work. So we see many people coming with foreign bodies which have small dust particles or metal particles or wood particles, and they are left inside for a long time. The main thing to do in this is to show the doctor immediately. Why? Because if the foreign body stays there for a long time, it can lead to devastating eye infections leading to permanent blindness. How does that happen? The foreign body stays on the black part of the eye, that is the cornea, sends in germs into the eyes which ultimately affect the vision. So go to the doctor, get it removed and take proper antibiotic eye drops for the prescribed period of time, and then things should be fine. The second thing I would suggest is to have good protection of the eyes while dealing with such work or while traveling. So that includes special eye gear that are prescribed by the company or the doctors. The second type of injuries are chemical injuries. They can happen anywhere, especially in the laboratories or in factories, or even while playing Diwali or Holi games. We can have firecrackers or the colors from Holi which can lead to chemical injuries. They can also happen in the house while you're dealing with liquids like Harpic or any other fluid that is used to clean the toilets or homes or detergents. So the best thing to do that you can do in such a case is to give a thorough eye wash. An eye wash is the most important thing that anyone can do before even coming to the doctor. Remember, the water has to be absolutely clean while doing such a thing, and the eye wash may have to be given for almost 10 to 15 minutes. Just a 2 or 3 minute eye wash may not be enough. And even then, there could be particles of the chemical that can stay inside for a long time, and that have to be removed by the doctor. So go to the doctor, eye doctor, immediately, and the doctor will immediately have a look at you, remove the foreign particles, give you further eye wash and give the prescribed medications. However, if the injury is very severe, for example, acid or alkali burns in factories or in laboratories, then sometimes an immediate surgery is also required to cover the bare areas which have got injured. Otherwise, it can lead to infections or even damage to the eye permanently. The most important thing again that I would suggest is to use protective eye gear while doing such things. For example, while playing Holi or Diwali, you can use a plastic goggle. While working in the laboratory or factory, you should use the prescribed glasses or frames that are given by the company doctors. And while traveling, you can use eye gear to protect your eyes. It makes a huge difference, definitely. The last type of injuries are mechanical injuries. They could be of two types: blunt injuries caused by, say for example, a tennis or a cricket ball, and penetrating injuries caused by a nail, a knife, or even a pencil or pen refill. I have seen such cases many times. So what happens to you? What do you do? You definitely don't have to give an eye wash in this case, because the water can enter the eye through the wound and cause further problems. So the best thing is to cover the eye with an eye pad or eye patch or eye shield, which is available in any pharmacy, and then rush to the doctor. Do not strain or cause any kind of pressure on the eye, because the contents of the eye can come out. When you go to the doctor, they will examine you and decide whether it needs medical treatment if the injury is superficial, but if it is deep, it will need surgery definitely, because the surgery can close the wounds, put the parts of the eye back into their place, and also avoid infection because they give antibiotics through injections or tablets. Once that is done, a thorough follow-up is required, because injuries can cause further complications in the long run that could be cataract, glaucoma or retinal problems. So a regular follow-up to the doctor is a must. So that's all about injuries in short, and I hope you take the requisite precautions to protect your eyes all the time, and remember to approach the doctor as early as possible. Any delay from your side can lead to devastating eye blinding complications. Thank you very much. Stay healthy, stay fit, and if you want to contact me or know more about me, please visit librate.com. Thank you.